Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and right off the bat we can confirm that this biceps anchor is torn quite a bit. You can see all the tearing here. We're going to use our shaver just to smooth out some of the tearing so we can see better. And then we'll place a stitch through that biceps tendon to secure it in a different part of the shoulder. Let me see, sorry, let me see the graph. Okay, so what we're going to do is we're going to take a stitch here. And we'll push that around the biceps like that. Pause, please. Okay, so I'm going to show you here the back of the cannula, get it around the biceps like that. And we're reaching to get the other end. Now what we've got is a lupus suture going around the biceps, and we'll take our spinal needle and our relay. First step is to just pass the needle right through the tendon there. Okay, I like that one. Pass. Load one into the suture. Okay, now we'll pass the needle one more time. Through. We'll go ahead and feed the needle through once again there. Grab it, back it out. And now we'll load the other end of the suture. Now what we've got is a real strong loop all the way around the biceps like that. And now we'll take our scissors and cut the biceps at its anchor. biceps is released. The edge of it is just right here. Now we look down at the anchor, we can see the biceps is no longer there, so that can't cause any more problems. We're going to put the scope in the front just for a minute here. Pause. Okay, we're looking from the front to the back. The anterior capsule and ligaments look fine. You've got some arthritic areas on the glenoid. Here's one of them right here. See, you've lost some cartilage down below there. If there's any loose areas, we'd like to know that now and smooth those areas out. So that's why I'm smoothing out with my shaver here, trying to smooth the edges of this defect out. These are just areas where there's been some arthritis in the joint. Same thing back here. As we look down here, we can see an additional area there. Okay, but the rotator cuff looks fine. So we're going to finish up inside the joint and get to work on any bone spurs in just a minute. Pause, please. Okay, we're just finishing up here. This is the bone up above. It's called the acromion, and we took off a little bit of the anterior lip up here at the top of the screen, just to make sure there was nothing that would pinch on the rotator cuff anymore. And then we've also released the ligament a little bit because that was pretty robust and looked like it could pinch on the tendon also. And then finally we looked at the rotator cuff and confirmed that there was no tearing on this side. And then we tied the suture for the biceps. The suture is right below there. Okay, so here's the suture, and that's for the biceps. The rotator cuff is normal below, so we're very happy with the way that looks. Okay, so we're going to finish up here and get you back to the recovery room in just a few minutes, okay? Good luck to you now. Bye-bye. Okay, it's Dr. Buford. We're getting started on the left shoulder this time around. We're getting our first look inside the joint. Things are looking pretty good. Here's the biceps tendon. Here's the biceps anchor.